Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Stephen Konya.
Hello, everyone, and welcome back to Straight Outta Health IT. This is your host, Stephen Konya, and I'm so happy to have you back listening in on this amazing episode of our program. Today, we're going to spend some time talking about how our federal government has had an impact on driving transformation of healthcare and some of the good things that are taking place, some of the opportunities that are still out there, and just in general, educating those who may not be familiar with some of the agencies that are really instrumental in impacting what's happening in our industry. Healthcare is an evolving field. The advancement in technology, it's no surprise that healthcare is now starting to take advantage of it. And one of the agencies that's leading that charge is the Office of the National Coordinator, or ONC. And it's revolutionizing how healthcare is happening through its health technology programs. These programs are designed to provide healthcare providers with tools that they need to better deliver patient care. And during this episode of Straight Outta Health IT, we're going to take a real closer look at these technology programs at the ONC, one of the individuals that's leading those initiatives, and how they're starting to impact and improve patient safety, track patients' lives better, and improve the overall delivery of care within our ecosystem. And who better to give us some insight on that, the ONC and the programs that are taking place there, than Stephen Konya. Stephen is the Senior Advisor to the Deputy National Coordinator and Innovation Portfolio Lead for the Office of the National Coordinator for Health IT, or ONC, which is a part of the U.S. Department of Health and Human Services. In addition to shaping the agency's long-term strategy, Stephen also serves as the primary liaison to the White House Office of Science and Technology Policies and an external healthcare startup and investor community. Furthermore, Stephen leads the Digital Health Innovation Work Group under the Federal Health IT Coordinating Council, which is an interagency collaboration community comprised of innovation representatives from 40 other federal agencies. Before joining ONC, during ONC, he's actually led a number of other initiatives, including HHS's Pandemic X Innovation Accelerator, the National Health IT Playbook, the ONC Patient Engagement Playbook for Providers, the Smart App Gallery, the FHIR, or FHIR, at Scale Task Force, or FAST initiative, and is a founding co-chair of Together.Health Collaborative, which we'll talk about in the program a little bit later. Prior to his position with the federal government, he served concurrently as Chief of Staff, Chief Operating Officer, and Chief Results Officer for the Illinois Department of Public Health. He was also tasked with leading the agency's innovation and open data strategy and was appointed chair of the Open Data Subcommittee under the Illinois Alliance for Health, a CMI State Innovation Model Planning Grant. Other assignments that he's had included appointment to the Illinois Commission of the Elimination of Poverty and a co-chair of the Illinois Workforce Investment Board Healthcare Task Force. And then earlier in his career, Mr. Konya served as Chief of Staff for the Illinois Department of Commerce and Economic Opportunity and CFO for the Illinois Human Rights Commission. He holds a BAA in Finance International Business from Loyola University in Chicago and has both a fellow and mentor of Mid-America Regional Public Health Leadership Institute program at the University of Illinois Chicago School of Public Health. Wow, this man has had an amazing career. No wonder I want to call him doctor. I think he's got the pedigree of a PhD with all the experiences that he has. So without further ado, let me introduce you to Stephen Konya. Stephen, welcome to this episode of Straight Outta Health IT. I'm so happy to have you on the program.
Thank you, Christopher. And I apologize to start things off here for you having to read through my entire biography. I thought you might pick and choose a few things. We wasted a lot of time.
Yeah, I would not do it justice.
Definitely not a doctor. I appreciate the kind words, but I have been in a fortunate position over the years to work with many doctors and try to be in a position to help support them in a number of different ways. Like there's critical work that clinicians are doing, and there's critical work that others of us who are not necessarily a clinician that we're doing, and the complement between the two that typically makes things work. I do appreciate that.
Yeah, you're very welcome. And I would be remiss if I did not let our listeners know the depth of your experience and the various roles that you held in the past. I will take all the time necessary to share that with you because it's background. And that being said, I read, again, that very exhaustive list of experiences and responsibilities that you have had in shaping not only what's happened in Illinois, but also now at the federal level. But that's just one part of your story, right? That's the resume. I always like to try to explore who is actually Stephen? What drove him to choose the career he chose? What are some of those milestones that led you to ultimately working for ONC? And then more importantly, what are you passionate about? What are those things that are driving you every day when you wake up to try to make a difference in our society? So I'll stop there and I'll stop talking. I'll let you tell your story.
I appreciate the opportunity. And like you said, although there's a lot that's in that bio, believe it or not, that is obviously just one part of it. And although it's a weird kind of eclectic background of jobs, maybe I can help tie some of that together, because I do think that there's some underlying passions that have driven me to make a decision to take each one of those career moves in my history. Maybe I didn't realize some of those underlying passions until later in my career, that they were kind of always there. Through an open mind and through discovery, was able to help find those things and realize it was something that was kind of the undercurrent in my career. There's a lot that's not in there. And one of the things that I don't think I mentioned in there was a former Marine. We like to say in the Marine Corps, once a Marine, always a Marine.
Exactly.
And I joined thanks. Well, it was a long time ago. It's been over 20 years since I've been out, but I joined the Marine Corps fresh out of high school as a way to get some money for college. And I was looking also forward to serving my country in that sense. I always knew I was going to be in the military. My father was in the military. Both my grandfathers in the military. Most of my uncles had been in the military, and all different branches as well. And so I think I was maybe 8 years old or 10 years old. I was pretty young when I sent away to the Marine Corps and asked them for if I could sign up, and they mailed me back a t-shirt iron-on decal. I don't know. You remember those old?
Yeah, I do. Absolutely. Because I actually thought about going into the Marine straight out of high school as well for those same reasons, for scholarship money, et cetera. But I ended up actually getting an academic scholarship. So I took that path, but I always wondered what it would have been like to have been a Marine as well. So thank you again for your service.
Yeah. Again, I was 8 or 10 and probably at the time wasn't thinking about college, but was really more just thinking about following in the footsteps of my family and serving my country in the military for some portion. And the Marine Corps was the agency that kind of I gravitated towards being the most intrigued by and wanted to join them. I think I liked their uniforms the most, and also heard that they had the most rigorous of basic training. So I wanted that. They told me not till you're older, and so I had to wait. And then out of high school, but I did join the Marine Corps, and I enjoyed my time there. I do think it had a lot of shaping who I am today, the way that I approach situations, and try not to get frazzled pretty easily if there's a stressful moment, but rather try to maintain my military bearing as we were taught, think through a situation clearly, clear mind, and calmly. And that's the best way you're going to be able to come up with any kind of solution. And if there is no solution, no need to cry over that spilt milk. You just pivot and figure out, okay, now how do we mitigate the fallout? So
there you go.
Pivot to the next step. Yeah, I think it really did help shape a lot of who I was. Now, I served in between the first and second Gulf War, so I never saw combat, something that I was very fortunate. But there was also this interesting kind of feeling of regret in what I did get out of being left behind, or never getting back or making good on the payment of all that training that the federal government gave me to, like, when I didn't go to that second Gulf War.
Sure.
So it's a weird, and I've talked to a lot of folks who have gotten out of the military and have been left behind when others get sent to a war combat. And there's this kind of feeling of survivor's remorse almost, or survivor's guilt, even though it's not that serious. It's not directly related to actually surviving. But there's a feeling of I didn't do my part.
Right.
And so
you served, and that's what's most important. You can't predict when wars are going to happen, but you can predict when you volunteer and when, you have served your country. I can appreciate you. That esprit de corps, I think is what they call it. Wanting to be a part of that, be a part of the fighting part of our country. But you're fighting in a lot of other ways now, which we'll talk about here in a little bit. But let me stop and let you finish your story.
Yeah, no worries. And I think it is a little bit of that feeling of being part of something bigger and understanding the criticalness of being mission oriented, mission focused. The sum is more powerful and more important than the individual parts, the sum of everybody working together. So I think a lot of that did get into my DNA, certainly. Some might say brainwashed through the Marine Corps, but it certainly carried how I've approached situations for the
Sure.
rest of my career. Now, at that time, I did not have on my roadmap to go into government work outside of the military. I thought I was going to do the military, go to college, get my degree after that. And then I was going to go be in corporate finance and be a mergers and acquisitions.
Exactly. What a major.
I had a plan, but I did have my mind open to new opportunities and following things that intrigued me along the way. And that's where I ended up getting to where I am now. But out of college, it was a matter of, I had this unique opportunity to work for the state of Illinois at a small agency where I could wear many hats. I ran the business side of the Human Rights Commission and had to do procurement and HR and everything else. I was there because everybody else were judges and attorneys. And remember, I thought I was going to go become an attorney. So I thought it was the perfect place to be leveraging my finance degree and at the same time get some experience in or being around a bunch of attorneys.
Exactly.
But then my career took a pivot when I got recruited to go over to be the CFO for the Commerce Department, which is the economic development agency for the state. And through the interview process, I was open-minded to it, but through the interview process, instead of getting the CFO job, they ended up offering me the chief of staff job, which the CFO reports to them. And that really gave me a lot of latitude to learn and to explore and to work across a much larger state government agency,
right?
And one that had a critical role at the time. This was right when there was the recession in the mid to late 2000s. The American Recovery and Reinvestment Act was pouring money out to try to kickstart the economy. And at the state level, it's the agencies like the one that I worked for that had a lot of opportunities to be creative in how to deploy that capital. And more importantly, get people back to work, help keep businesses from falling apart and making sure that they can weather the storm. And being out there doing a lot of community events on behalf of the government, helping the residents in the state understand that we were there for them and that we did care. We were doing everything we could, and being present in those meetings also really helped me understand the value and the critical role that government can play in supporting a much broader ecosystem in society. And I also in that time got to spend a lot of time working in our Office of Entrepreneurship and Innovation Technology.
Sure.
And as a chief of staff, you get to kind of pick and choose areas of the agency that you're kind of gravitate towards and are interested in.
That whole merger and acquisition thing started kicking it up.
Yeah, you never know. Yeah. That's where we were really looking at it. How can we get the economy back on track? We were trying to figure out what can we do to foster a better ecosystem for entrepreneurial activity? How can we attract more investors to the region? How can we get more startups to be successful and connect them to a broader ecosystem for mentorship and support and pilot opportunities, you name it. And it's an industry agnostic at the time, although eventually we would start to focus on our first industry focused initiatives, which are actually at the time around clean energy. So we were trying to build a clean energy innovation ecosystem in the region. And then later down the road, healthcare was probably the next big one that we evolved into. But we got to look at the science of what it takes to create the conditions for a highly collaborative innovation ecosystem, getting startups to work together with subject matter experts at large companies. In this case, today working with health systems and payers and others. How do you get not-for-profits and academia to contribute to that same ecosystem? How do you get state and local government and federal government to all participate in that? Basically, how do you create the conditions for everybody to come together, literally in a physical space, but also just virtually through the network effect?
Same mindset,
better, more efficient use.
Exactly. Same mindset, same goals, and do that in a very collaborative way. So, wow, what a great opportunity to cut your teeth on that at the state level, and then obviously taking that to a larger scale at the federal level now with the role with the ONC.
Yeah. And you got to remember, when I was at Commerce, I had no healthcare background.
Right.
So it was really the last federal or state agency that I worked at, which was the Department of Public Health, where I got recruited to head over there and help basically give the subject matter experts that they had at the Department of Public Health, to give them all the tools and resources and partnerships, strategic partnerships, how to bring in the innovation community to help them support the initiatives that they needed to get done, to bring more resources to bear in a collaborative way. Their chief of staff and CEO at the Department of Public Health. And this was right when the ACA was being implemented.
Exactly.
Right. So again, here's the thing. Healthcare as we knew it at that time was going to be totally different. The ACA, although there's a lot of critics of it and a lot of people who applauded it, either way, there's people on both sides of it. One thing you can't deny is that it changed the future of healthcare's trajectory forever.
Absolutely.
And it changed that national question of, should we reform healthcare, to what's the best way to reform healthcare? So that healthcare as we knew it was not going to be the same. And for me, it was a chance to learn alongside all the ones who had been in healthcare, who were trying to figure out what is the new healthcare going to look like.
Exactly.
It was a good time to get in.
Not to mention
what's going to be so different.
Absolutely. Not to mention the huge investment as a part of that in technology in healthcare, and that becoming a major game changer in how we deliver care today.
Yeah, no, it's actually funny because about the same time that I was getting started in state government was the same time that ONC was at a national level was growing up and maturing. For your listeners who aren't familiar, ONC started under the Bush administration as just an executive order from then President Bush to create a single national coordinator for health IT across all federal government. And the idea was that you would have this czar, if you will, who can help coordinate across all the federal agencies, whether it be CMS, FDA, all the healthcare agencies, but also non-healthcare agencies that have some kind of a healthcare angle to it. And that position grew to having a staff of about 30 people or so over the next few years. And then it was when the ARA, or the American Recovery and Reinvestment Act, was passed, that's when the HITECH Act was part of it. And, and a lot of people forget that was really meant to stimulate innovation and growth in a sector, which is healthcare, that was lagging significantly behind other sectors when it came to the adoption of technology. There had been a lot of innovation in healthcare, but it was all primarily on the drug side, diagnostic, and treatment pathways, things like that. But as far as like leveraging technology to do the care, it was still very immature at that point. I think it took over 90% of all healthcare data or information, over 90% of it was still on paper.
Exactly. And the majority of those systems that they were leveraging were financial or administrative driven. They weren't clinically focused as well, too, outside of just the standard clinical technologies like radiology systems and things like that, but not information technology systems.
Yeah, exactly. And so the HITECH Act was that stake in the ground that said, you know what, we're going to help create the incentive structure and then also technical assistance and support to actually help healthcare adopt technology to move to electronic health records. And that's where ONC, with the HITECH Act, became an official federal agency and not just a position with a staff of about 30 or so, but rather really a full-fledged official federal agency. And then grew in size from its staff, although we're still pretty small as federal agencies go. But that's where it grew. And really, that's where Meaningful Youth launched. We worked closely with our partners at CM to help set up the incentive structure. And in our hallmark program that we're known for, which is our certification program, was first established, and setting the technical criteria for certified electronic health records or health IT. And that's a program we continue to manage to this day that Epic and Cerner and on all the other health IT companies that health IT vendors have to conform to. And we use third-party organizations like Drummond to actually do the certification of that criteria and test those different organizations. But when a lot of people think of ONC who do know us, that's what they first think of. Oh, you guys regulate or certify electronic health records.
Right. Well, yeah, and I was just going to comment. ONC has really, truly been the catalyst for transformation in this industry. It's been instrumental to supporting and promoting innovation. It's also launched other programs like the Million Heart Initiative, which had an aim of preventing 1 million heart attacks and strokes by 2022. And to your point, also, it's been a key in supporting the implementation of some of these emerging technologies like telehealth and mobile health technologies, now AI and others that are starting to have a huge impact on healthcare.
Yeah. And it's interesting because, as you mentioned, a lot of times we can get credit for leading something that maybe we didn't lead. Maybe we just supported or participated in it. And other times we don't get credit for things we actually did lead because we really try to flex the C in our name, which is the coordinator. Sometimes that just means it's really more of a collaborator. But leveraging our position and our expertise and our unique role within federal government to bring everybody to the table, to look at who's doing what, to figure out where there are gaps in that coordination, and then working with all of our federal partners and our other agencies through the Federal Health IT Coordinating Council and other ways to make sure that the federal government is taking a comprehensive look at these things and that we're not competing with what each of us are trying to do. The last thing you want is for FDA to create one standard and then ONC to create another standard and CMS to have a third one. And when they all go to sync up, none of them talk to each other or work or sync. And I think probably our most important role that a lot of people don't realize we do is that coordination function. It's a heavy-handed coordination function, and sometimes it is a soft coordination function, but it's really managing relationships. Sometimes it's supporting and partnering and lifting up the other agencies' initiatives. And then other times it's leading it and making sure that we're creating the space for them to participate in it and be at the table, make sure they're aware of it. It's I think a very powerful thing that we get to do. It gives us a lot of influence, but it's a big responsibility, right? Because, when something goes wrong and you don't have regulatory oversight in a certain area of health IT, or you don't have standards to support it, that's where the industry and sometimes Congress or the administration looks for someone. Say, well, okay, why didn't you guys do this? And
exactly right.
The buck ends up stopping at us. When everybody starts pointing fingers at everyone else, eventually they all start pointing at us. But luckily, we've had such an amazing set of leaders over our history at the ONC, currently with Mickey Tripathi as our national coordinator, and then also the staff. The staff we have, we have many of our staff have been there for a very long time. and believe passionately about this work, and a testament to their skill. My colleagues that I work with, I play one small role, but there's a lot of people who've been here for a very long time. And it's an art form to figure out how to navigate these waters and collaborate and work with our federal partners, to work with industry, to work with Congress, to make sure that we're covering all these areas, because there's been little to few times that we've had that missed opportunity because we are trying to be so proactively focused on it.
No, absolutely. And I want to delve into, for those who may not have a good understanding of some of the programs that ONC has coordinated. And I know there are a few that you're passionate that you want to talk about. I know one I was involved in as a reviewer, the Blue Button Challenge as well, too, is one that I think was helped to shape a lot of innovation that's happening in our industry. And then Cancer X is another program that I'll let you spend a little time drilling into, as well as the Clinical Trial Readiness Initiative as well. And then just those federal innovation days that are coordinated through ONC as well, too. So I'll stop there and let you maybe touch on a few of those that you feel really passionate about sharing.
Yeah, it's like trying to pick your favorite child.
Exactly.
Right. And I'm not saying these things are all my children, but it's a similar parallel. They're all highly valuable, amazing programs. ONC does amazing work. And I don't think enough people really fully understand the breadth of work that we do. And all the people, again, they think, oh, you certify EHRs, and they think that's all we do. Oh, you guys, work with fire accelerators and HL7, and they think that's all we do. A lot of people don't realize we've got a history in supporting the healthcare technology workforce and have helped develop curriculum to support the training of the next generation of technologists and informaticists who are going to both build, develop, implement, use these systems. That's something that people don't have any idea that ONC's been involved with. Now, This isn't something that we've continually done year in, year out, but there's been a few times that we've been blessed with some support from Congress to get some funding to help kind of do this work. And we've built on it each time. Most recently, we were able to launch our public health informatics training, or FIT program, PHIT. And it was a unique opportunity coming out of the pandemic where there's some money available. And the idea was to figure out how can we increase the diversity of the next generation of public health informatics workforce, and getting more diverse populations from communities that often are most impacted by the availability or use of these solutions, or misuse of these solutions in some cases, to make sure that we're getting people from those communities and those different demographic areas to go into that career field and to understand the importance of it, right? We partnered with HBCUs and this really amazing program. It's still ongoing right now, but that's one example of something where people are like, wow, I had no idea you guys work on public health.
Yeah.
Or even we're also leading with the CEC, Mickey Tripathi, and he serves as a co-lead to the Public Health Data Modernization Initiative, along with the CDC, another thing that came out of the pandemic. So we do have a big public health focus that a lot of people don't realize we've done as much on. And then global, that's another area that a lot of people don't realize the breadth of work that we've done in the past and are currently doing when it comes to the global stage. Currently, ONC serves as the secretariat and chair of the Global Digital Health Partnership, a national collaborative of over 30 countries that are collaborating on health IT implementation and innovation and coordination. Some of it is just sharing best practices of what each countries are doing. And some of it is actually coordinating and collaborating on how can you have the exchange of data between countries. International Patient Summary Work, or IPS for short, we call IPAS. We're coming up with standards for what kind of minimal data needs to be available for folks who are traveling either as a tourist or maybe are an expat, and they need that critical healthcare information to be accessible out of country, in another country.
Yeah, that I didn't know. Wow.
So we work, and again, we have a whole global team, an amazing global team that manages these relationships with these other countries. And then basically, Mickey Tripathi is our boss in the U.S., the coordinator. And through this organization, we have relationships with, again, over 30 other governments, their version of Mickey, whoever's running their health IT in their countries.
Exactly.
In fact, we're going to be hosting next week the Global Digital Health Partnerships big annual summit will be hosted in DC because we are currently the secretary. So the secretary always hosts each year, and next year it'll be in the Netherlands, where the Netherlands will be the next secretariat. So again, these are just a few examples of how diverse ONC's programs are. And we certainly won't have enough time today to go through even just talking about all the current ones, let alone all the ones we've done in the past, because it really is a ton of amazing work that's going on. I encourage folks to subscribe to our newsletter, because it's a great place to keep tabs on all these things and to see all the breadth of work we're doing.
No, that's great. And actually, I've learned a few things here. I thought I had a pretty good understanding of the initiatives that are happening at ONC, but I'm amazed at what you're not only doing domestically, internationally, and leading those efforts as well, too. So I commend you and the rest of your colleagues at the ONC for truly not only transforming healthcare within the U.S., but, globally as well. That's huge. I did want to take a few minutes, too, because in your resume, You did talk a little bit about you co-founding the Together Health Collaborative, and wanted you to maybe take a few minutes and talk a little bit about what that's all about and your reasons for co-founding something like this.
Yeah, sure. So to be honest, it was both the fact that, it's one of those things where it's like, this is a good thing to have, but also
Right.
selfishly, it was very personal to like meeting my requirements and my job description of what I'm supposed to do. As a federal employee, I have a pretty unique job description. It says things in my job description that build collaborative communities in the innovation space or things like that. And so
Sure.
be that liaison or that one who advocates for and works directly with innovators, quote unquote, right? And first thing when I started in 2015 at ONC, we had to come up with a definition of who is the innovation community in our eyes as a stakeholder group. And but startup, it's also innovators and entrepreneurs that maybe aren't necessarily part of a startup, but are within a large organization. And they're the ones who are challenging the status quo, want to build a new solution, basically aren't satisfied with the way that things are and want to create something new, a better mousetrap, as they say. But it could also be those who fund and invest in those solutions and help implement them and test them. So it could be the early adopters in an organization who maybe didn't build the technology, but know they want to try out something new. They want to be on that cutting edge. And push the
Sure.
envelope, right? And then other times, external investors, venture capitalists, angel investors, corporate investors, et cetera, that can help fuel these innovations and bring them to market. And then it's the group of advocates and organizations that support all those other groups. So it's incubators, accelerators, boot camps, association, other ones who kind of advocate on behalf of and help provide the spaces to give all the resources and support and connections to those innovators to make them most likely to support.
That's an interesting melting pot of stakeholders. One, what is the mission of Together Health? And then two, who are the types of,
Well, yeah.
No, you can't mention everybody by name, but I'm just curious what types of companies or organizations are involved in an initiative like this, and maybe share a little bit of one or two of the initiatives you're focused on.
Yeah. So again, what I was describing before was just a definition of the innovation community.
Mhm.
Together Health, I had to think through how do we build a structured relationship between our agency and the innovation community.
Mhm.
And leaning on my experience at the state government commerce department, where we were building innovation ecosystem on a regional level, I was thinking of how can we build a national innovation ecosystem. And so we looked for in each city, in each region throughout the US, who were the organizations that were the nexus of all that local innovation. So if you think about who was the champion for each regional innovation ecosystem, how can we bring them together and connect them on a national level to create a national innovation ecosystem? One, it's great because at the time they didn't really know each other and they saw each other as competitors, which is a bad thing because by no means should they look at each other that way. But number two, and again, selfishly for me, it made my life a lot easier in managing that relationship because now as a hub and spoke model, I can go with one organization and then that then goes out into each region, into each ecosystem and vice versa. So for having a founding post and a place to share all the things we're working on and then to be listening on where there's friction in the marketplace, having Together Health as an organization that brings together all these regional innovation ecosystems, it really did save me a lot of time and effort. But as far as your question on who's involved in it, the co-chairs rotate every few years to make sure that, each organization can put its stamp on it and it helps lift up some of the work that's happening in these different regions. There are some non-regional specific organizations that are involved, like the AMA, it's their digital health team, or JLabs, the National Accelerator Network, and a few others. But really, I think a lot of the strength relies in the local organizations or the regional ones. And some of them have expanded into multiple regions now. If you think of who's the organization that brings together the innovation community in Chicago, most people would say Matter. And historically, also HealthBox played a big role in that early on. So they're part of it. And they create those serendipitous collisions and opportunities to bring that whole ecosystem together. But if you think of one of the ones in Boston, there's a lot of them in Boston, but there's a few that we actually work with at Together Health. But one of the ones is Mass Challenge and their health tech vertical. And they provide a lot of the ecosystem building work out of Boston. So if you pick a city, we've got, I think, 30 something, almost close to 40 cities now that are represented in Together Health. But it's not the same kind of organization. In some cases, it's government related. It's called a private partnership with local government. In some cases, Tulsa Innovation Labs gets some support from their local economic development agency, and it's all about they have a big healthcare focused program there. They bring the ecosystem together in Tulsa, Oklahoma. So a lot of people probably didn't even know the great work that's happening in Tulsa, Oklahoma when it comes to healthcare innovation. You got Health Tech Arkansas, you got Nashville Healthcare Council and Project Healthcare out of the NEC, or National Entrepreneurship Center, which bring together the Nashville ecosystem. And you get two totally different types of organizations. You've got organizations in LA like Scale Health, who's actually got a presence in a couple of different cities, Prime Health in Denver, and so on and so forth. They're all different organizations, but the key underlying element is that they need to be someone who is highly collaborative, brings their whole ecosystem together. They're that safe space for collaboration. And then again, for ONC, it's a great access point for us to be able to promote the programs, the work, raise awareness about new policies and regulations. And then more importantly than that, listen for like, where is there friction in the marketplace, things that are slowing the adoption and challenges with the use of health IT and so on. It's a great feeding ground because it is so diverse, right? And if we hear it coming from a number of ecosystems, it's usually a good signal that we should probably be doing more work on our end to try to address some of those challenges.
That's exciting. The public, private, government, education, investment, collaborative to help really transform healthcare. We'll have to watch closely and see the impact that the Together Health Collaborative brings to helping to transform the industry. I wanted to, as we start to get ready to wrap up our program, for you to maybe share a little bit from your perspective. What do you think are some of the biggest challenges right now that our ecosystem is dealing with? And then how is ONC trying to help bridge the gap there?
Yeah, that's a great question. One of the fortunate things about being an innovation portfolio lead and working with the startup community, investor community, is you can see a lot of what I call what's on the horizon, the horizon portfolio work. Mm-hmm. And that's both good things, the exciting things like Chat GPT and digital therapeutics, but it's also seeing sometimes where there's concerns or potential safety or privacy risks or other things like that with the adoption and use of those technologies. So with any emerging technology and or application of those technologies, when you bring it to healthcare, it tends to get more complicated and the risk is significantly higher for it to go sideways. And ONC has been evolving since the early 2000s from where it was very focused on adoption and getting everything into a digital format. The middle years were all focused really on interoperability, and we're still focused on that. But today we're shifting into also looking at really the responsible use and governance of all these types of technologies. We just released out for public comment. We proposed a new rule, HTI1. It's on our website at healthit.gov. I highly encourage you to look at that and comment on it for all your listeners. It's got a lot in there. There's updates to the certification program and focuses on some other updates and comments around information blocking. For the first time, we've expanded our look at our role with clinical decision support systems, or what we're calling now predictive decision support interventions, or PDSIs. It's another more technical way of saying AI, just for the basic listener. But thinking through really the responsible use of AI in healthcare and what role does ONC have in helping to encourage transparency and accountability of these tools, especially if they're being built by or delivered through an electronic health record, which is our domain of what we have oversight for. In addition to that, we're collaborating work with other federal agencies like the FDA, like CMS, StarQ, like NIFC, and the White House on the responsible use of AI in general as it applies to healthcare, and come up with frameworks for that. But we've already taken a step forward to think through how can we increase the opportunity to have health systems be more informed as they're evaluating these tools and solutions. And it's something that I'm really excited about. We've done a good job at getting the industry to adopt electronic health records. We're now, 90+% is now in digital format. It's a complete reversal of when the statistic I gave you earlier. And so we have high levels of that adoption, but we've got to think through now, what are the unintended consequences of having all the, and it doesn't now present some additional risk along with all that opportunity. And so I'm excited for some of those types of aspects of work. I know that mitigating for bias and algorithms that can exacerbate existing societal bias is a big problem. And again, we're collaborating with all our federal partners on this topic and really seeing what can we do in our own limited role where we do have direct control over something with the certification program. But we've got brilliant people at ONC who worked really hard on crafting up the proposed rule out for public comment. I'd love to get folks' thoughts on it. And again, that's just one example. There's a lot of other areas right now. When we think about US CDI, the US Core Data for Interoperability, that's the last thing I just really want to plug here. It's something that we are required to do under the Cures Act. And we've now expanded that into US CDI Plus, looking at specific niche areas of healthcare where we need to evaluate, bringing together more mature standards in a certain space. And potentially they're ones that could then be qualified to enter into the US Core Data for Interoperability. But at a minimum, just creating these affinity groups to be able to coalesce around US CDI Plus for cancer or for research, et cetera. There's a number of areas where we want to be able to focus in and help the industry kind of coalesce around those standards.
No, that's great. One, I'm just blown away at all the activity that's taking place within the Office of the National Coordinator for Health Information Technology. I was hoping to have a conversation today about one or two of those issues, and I think you rattled off about 20 things in the span of about 30 minutes here. So one, we got to have you back on to continue the conversation and delve in deeply in some of those areas. One, I'm very passionate about this is a whole artificial intelligence component of that. So would love to talk more about what's happening there and get ONC's perspective on it, what's happening from a federal governance perspective, because there's so much chatter out here about ChatGPT and AI and its impact, and to your point, the inherent biases that could exist within those technologies. And I'm just curious to hear, what is our federal government and agencies like ONC doing to help mitigate some of that risk, or at least provide guidance around that as well. So rest assured, you'll be back for another round of conversations in that area. So when we've come to the end of our time, it goes quickly, especially when you have good conversation like this one taking place. I want to give you just a minute or so to just wrap things up, offer your perspective for a commentary on anything you would think our audience would want to hear or learn more about ONC, or some of the initiatives that are taking place within that agency.
Thanks, and I'll try to be succinct here. You'd mentioned to me before that you like your podcast to showcase career journeys, and
Yes.
for someone who's wondering how did I get into the position I'm in,
Absolutely.
you get to work on the things I work on. Real quickly, I'll just say, be open to opportunities that come your way. Always good to have a plan, but then if things knock on your door, and at least hear them out, explore it, because you never know. I never would have thought I'd ended up in healthcare. And here I am now getting to work with not only all my amazing colleagues at ONC and across HHS, but I also get to work with folks in the White House and then across the industry. So it's in healthcare, and it's a really unique place to be, an exciting place to be. And I never would have got here if I wasn't open to those unique opportunities that came up that maybe at the time didn't seem like a natural fit for me. So that's number one. Also, if you want to know how to apply specifically for government positions, feel free to give me a call. So you can look me up on LinkedIn. Then I'd be happy to talk one-on-one with any of your listeners about navigating the USA jobs application process and some tips for how to get recognized and get your resume, because there's a bit of a AI filter. And how do you get through that AI filter? It's challenging sometimes to even get landing on a real person's desk.
Exactly.
So I can answer those questions. Now, aside from the career thing, in ONC side, the biggest takeaway I want your listeners to have is that we are a coordinator, but really we are more of a collaborator. And to think of us that way, subscribe to our newsletter. If you go to healthit.gov, our website, and a pop-up window will probably show up saying subscribe to our newsletter. And if it doesn't, click on contact us and you can subscribe there. But it comes out on Tuesdays. It's amazing content, quick, easy to read, and that'll educate you and also let you know of opportunities to collaborate and partner and work with us. Everything we do is in collaboration and in partnership, either with other federal agencies. We promote a lot of the work that they're doing. So even if we don't own the initiative, we like to showcase it if it relates to health IT, other engagement opportunities, funding opportunities. And then, of course, also reach out to us. If you're having trouble bringing innovation to market or implementing something, we love that feedback. We want to hear it both formally, informally. There's a way you could anonymously report it on our website. So feel free to do that as well through our feedback form. You can click on the sub area of health IT and then either ask to be followed up for us to get back in touch with you, or you can just say you want to do it anonymous and then we don't have your contact information or anything. But we need to hear that raw feedback and that raw intelligence. And we try to get out of the DC bubble and travel around and go to different conferences and events and these regional events where we are bringing all these federal innovators to different cities to hear that feedback. But we know it's still hard to get, and you might not always be able to come to those events and conferences.
Sure.
Please feel free to reach out to us. And if you got ideas on how we can help support the further adoption and responsible use of health IT, we certainly want to hear it.
Wow. What an amazing program today, and what a wealth of information you've shared with our listeners. To those who are looking for jobs, he's raised his hand, so don't be afraid to reach out and try to connect. And for those who are entrepreneurs who are trying to bring innovative solutions to the space, ONC can be a great partner for you on that. And then for those providers who are looking to continue to lead the efforts on the adoption and disruption of technology within healthcare, ONC is always looking for partnerships and relationships there too. So I want to take, again, a moment just to thank Stephen Konya, Senior Advisor to the Deputy National Coordinator and Innovation Portfolio Lead for the Office of the National Coordinator for Health IT, ONC, which is a part of the U.S. Department of Health and Human Services. I want to thank you and your team for the amazing job that you guys are doing. Continue to be that coordinator, that catalyst, I like to think of as well, and helping to innovate and drive change for the improvement of healthcare within not only the U.S., but the broader community as well. That's it, folks. Another episode of Straight Outta Health IT is in the books. I want to thank you for taking time out of your busy schedules to tune in and support the program. If you like what you heard today, please share the link to our podcast with a colleague or a friend. Let's make Stefan's episode go viral. And I look forward to seeing you next time on the show. Until then, take care and God bless.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Konya on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.